If you've ever wondered who cracked the code on peripheral nerve surgery, let me introduce you to Dr. Dellon, a true pioneer whose curiosity and determination have transformed the way we understand and treat nerve disorders. Professor at Johns Hopkins, surgeon, scientist, he's the mind behind nerve decompression, and honestly, his work has changed my entire view of neuropathy. Dr. Dellon's career is a testament to the power of combining clinical practice with relentless scientific inquiry, and his impact stretches far beyond the operating room. Let's rewind a few decades, back to a time when the field of nerve surgery was still in its infancy, and many questions about nerve pain and dysfunction remained unanswered. Diabetes was, and still is, a leading cause of neuropathy and, heartbreakingly, amputations. Patients would often lose sensation in their feet, develop ulcers, and face the devastating prospect of losing a limb, with little hope for recovery. Back then, nerves were a black box. We knew patients suffered, but the why and how, that was a puzzle. Enter Dr. Dellon, who saw not just the suffering, but the unanswered questions behind it. He didn't just accept neuropathy as an inevitable complication. Instead, he challenged the status quo, refusing to believe that nothing could be done for these patients. Instead, he asked, what if nerves, when trapped or compressed, can be rescued before permanent damage sets in? What if there was a way to intervene early and change the course of the disease? And he didn't stop at people. He took this question straight to the lab, using mice to dissect how nerves respond to both pressure and elevated sugar. His results? Game-changing. He demonstrated that nerves under stress from diabetes are even more susceptible to injury from compression, opening up a whole new avenue for treatment. Through meticulous experiments and innovative surgical techniques, Dr. Dellon showed that decompressing nerves could actually restore function and sensation, something previously thought impossible for many patients. He redefined the double crush theory, originally put forward by Upton and McComas, showing that diabetic nerves are uniquely vulnerable to multiple sites of compression. This insight fundamentally changed how doctors approach nerve problems in diabetic patients. His research didn't just fill journals, though with over 800 articles and a textbook bearing his name, he's certainly left his mark on the literature. His work has become required reading for anyone serious about nerve surgery or diabetic neuropathy. It's the ripple effect that matters most. Dr. Dellon's discoveries have spread far beyond his own practice, influencing countless doctors and improving the lives of patients worldwide. Thanks to his discoveries, thousands have kept their limbs and their mobility. Families have been spared the trauma of amputation, and patients have regained independence they thought was lost forever. Surgeons around the globe adopted nerve decompression, offering hope where there used to be only resignation. His techniques are now taught and practiced on nearly every continent. Personally, I had the privilege to study and work side by side with Dr. Dellon. Watching him operate, teach, and innovate was an education in itself. He's not just a brilliant scientist, he's a generous mentor. He takes time to nurture the next generation, always encouraging curiosity and critical thinking. Through what I call the Dellon lens, I learned to see neuropathy differently. I began to look for solutions where others saw only dead ends. He encouraged me to challenge established thinking, which led me to develop my own global compression theory. His influence continues to shape my approach to every patient I see. For anyone in medicine, Dr. Dellon's legacy is a reminder: never stop asking questions. The next breakthrough might be just one thoughtful question away. Never accept suffering as inevitable. Always look for the possibility of healing, even when the odds seem stacked against you. Thanks to his relentless curiosity, we've reimagined the very architecture of nerve disease and changed the lives of countless patients. The field of nerve surgery will never be the same. So if you look at a patient with neuropathy and see a chance for intervention instead of a lost cause, you have Dr. Dellon to thank. His vision has given hope to so many who once had none. And I'm grateful every day to call him my teacher, my mentor, and a true inspiration in the world of medicine.